Hello, everyone out there, and hello, you who have just stumbled upon this channel. My name is Janet. I am a registered nurse with accident and emergency background, with some surgical ones as well. Um, I This channel is actually backed by a group of individuals who are professional. Let me use the word expert in their professions, various professions. I mean, they're good. They're good in their professions. So you are in safe hands. The aim of the channel um, is to I'm looking for the right word. Is to improve the well-being of the family. I mean, the whole family. So it's made up of we have health experts, we have some um, banking backgrounds. So it's a mixture of both, and we are still looking for people out there who have um, the who are actually good in their profession. If you believe you are really good in your profession and you have something to give back to society, you are so welcome to join us. We have no limitations at all. So, however, it's just a small group. We aim to keep it a very small group. So, if you are interested in helping um, build your community, improve the well-being of the family. As you improve the well-being of the family, it transcends down to other members of the community, and in the whole, we all go together and we live a happy and a healthy life. So this is what the channel is all about. So in short, I am an RGO nurse with ED and surgical background and a well-being advocate. Thank you for joining me. Please subscribe, like, and share. Don't forget to click on that notification button so that anytime a video is uploaded, you will be the first to be notified. Um, Actually, this video was supposed to be done. I meant to record this video yesterday. Unfortunately, the nurse ended up in ED herself. I had to be taken to A&E because I had tummy upset. And this is the second episode within 2 weeks. So I've kind of have an idea where it's coming from. It has to do with our food handling. How safe are we? We rely on grocery shops. We intend to get the best from them. So um, we expect that when you are buying something, when it reaches you, it should still be wholesome enough for you to eat. Yes, you, the consumer, you have your responsibility of preparing your food properly. However, how does it get to you? Sometimes you kind of feel uncomfortable returning, let's say, just a cauliflower, a bowl of cauliflower. Who will do that? And you are like, okay, let me peel off the leaves, wash it a bit, and then I'll be fine. But how well can you wash the cauliflower? So, our vendors out there, our grocery shops out there, please, please, there are rules, there are laws governing handling of food. Make sure your ingredient, what you produce, get to the consumer as wholesome as possible. Yeah, I just needed to touch on that. And a little bit about our health facilities, especially those of them that work at night. It will be so good, so good. And it goes to the authorities, the ministers, the government, everyone out there. Let's make plans to have a small night running pharmacy. I mean, a pharmacy, a chemist store, a chemist shop, a pharmacy. Something that can be managed by, let's say, a pharmacy technician or a pharmacy who is willing to do a few hours at night. Something small, just the those ones that can be a patient can be discharged with if it's not available in the department. So the patient can actually purchase that and then use it. You wouldn't have to wait, especially if it's a weekend or a Sunday. You wouldn't have to wait till the following Monday before you go buy medication. Continuation is key to a quick recovery. So I'm not going to talk so much about that. I had something planned that was just by the way. I'm going to touch a little bit on what I spoke about in my last video about weight management. Um, I did touch on pre-diabetes, what it meant. I did put it out there that you, the layman working in the community, and you, the health worker out there, if someone said or a senior colleague told you that we are suspecting pre-diabetes, what does that mean to you? I made some notes, so I'll be looking down um, from time to time, and pardon me for that. So um, I'll first touch on weight management. This is not into details, mind you. As time goes on, we will get an expert who would speak a bit more regarding these issues, diabetes, weight management, and other. We would actually, myself and the group back me will make sure that we get the experts to speak on specific topics. Okay, those that I can manage and tell you about, those that can help you get along till you get detailed information, I will be doing those. So weight management. When we talk about weight management, what comes into my mind, and I'm sure most of your mind, is weight gain. Um, Weight gain, that's being overweight and then being obese. Honestly, it's one of the contributing factors for most of the conditions we suffer. It is. I mean, those degenerative and those diseases as you age. Really, nowadays people don't even age that much before they start being diagnosed with these diseases: hypertension, high cholesterol, and diabetes. That doesn't mean that slimmer ones are not diagnosed with those. They are also diagnosed, but it's much more um, seen among those with the weight, overweight, clinically, I mean, clinical overweight. So, bear that in mind. The thing is this: being clinically overweight or obese doesn't come, you can see it physically, especially among us women. Curvy we are now, the curvier the better. But however, if it is looked at clinically, most of us are overweight. And there are a lot of people who are pre-diabetic out there and do not know it. So we need to pay attention to that. Yes, we love the curves, we love to flaunt them about, but we need to be careful with our lifestyles. Okay. Um, as we go on, I would like to explain what prediabetes is. Um, Prediabetes, it's when your HbA1c is higher than normal, but not high enough for you to be called diabetic and be treated. Okay, so the HbA1c is a type of test that is done. Okay, so this is actually conducted in a health facility. usually through your GP surgery. And for a health expert to actually tell you that you are pre-diabetic, this test should have been done through a period of time. I think it ranges between 3 to 6 months. And um, I'll mention the values, and other factors, lifestyle factors, family history, all play a role for them to tell you that, okay, I think you are pre diabetic. I'm saying the other factors involved because I've actually, through my research, I've seen two ranges, one generated by AI and then one by a health expert. So I think it actually depends on the school of thought and what you and the other factors that come with the disease that contribute for you um, acquiring the disease. Um, the um, the so the values according to AI. Now everybody is going, oh, technology crazy. So hey, why not? Let's use it. According to AI, is about 4 to 4.7 thereabout. So if you are within that range, you can be um, um, said to be pre-diabetic. And those of us not in the Western world, I'm not sure how often we use the word pre-diabetes, but I do know that your health expert will tell you that be careful, watch your weight, watch what you eat. They will tell you, otherwise you will soon go on medication and all sort of stuff. By the word pre-diabetes as to how if it's being used out of the Western world, I wouldn't be able to tell. Okay, so now the other value that I found is from about, let's say, 5 to 5.7. Okay, so if you are within that range, you can be said to be pre-diabetes. And usually it comes with other factors, your lifestyle, how you are, your physical build and all that. I touched on the weight gain earlier. So all these factors come into play to make you to for we to say that, okay, you are on the verge of being diagnosed a diabetic. So that's what I wanted to talk to you about on the blood test that is actually done for for diagnosis to take place as to whether you are diabetic or pre-diabetes. However, there is this other blood. Oh, let me touch on this. Sometimes they may ask you to fast. Um, Previously, I do know that we do say, oh, fasting. The patient had to fast overnight before this test is done. But these days, it's not so necessary because of advancement and all that. So it's not so necessary for you to fast before the test is actually done. So there is a difference between the HbA1c, and then um, blood glucose, or the BM that most of us call it in our health in our workplaces. The blood glucose, which is the BM that we actually do on patient, which sometimes patients do on themselves at home, is actually the 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 levels the level is actually read after let's say a couple of hours after a meal. Okay, so this is when you use those small glucometers, those small machines, and we do the finger prick. And I think there are more advanced way of doing these tests now. And then the blood is taken, and then it gives you the value. Usually, when you are on admission or you are in hospital, It has to be done before your meal, and then couple of hours after your meals. Usually, that's for good monitoring to see if you are recovering whilst in hospital. This is what is done. So the one that you do at home, okay, doesn't necessarily say that you are a diabetic. So let's say you have a relative at home who is diabetic and is doing this test. So this machine is actually at home. And you also take it and then you do a reading on yourself. It does not tell you whether you are a diabetic or not. No, that's not it. For you to be actually diagnosed diabetes, you have to see a health expert. You have to see your doctor for the test to be done. Okay, so that's what it is. I think I've touched on nearly everything that I intended to say today. So factors that influence these conditions are lifestyle, um, family history, and basically it's your lifestyle and family history. So these are things that we should take into consideration when we are talking about well-being. I'm not saying that there are no other illnesses that contribute to the decline in the well-being of an individual and as a family as a whole. There are, but these diseases are becoming much more common, and the economic impact on you, the family, and then the government, the National Health Service. You can just imagine. So if we should do our bit by controlling factors, being able to control things that we can control to curb down the occurrence of these conditions, can you imagine how well the community and your family will be? So let's make it a point to all look after ourselves. To end this chat, I read this from one of the GPs whose webinar I attended. She's a diabetic expert. Actually, she's a GP in Wales. That's Dr. Frater. She says, and she was actually talking about what we eat, the thoughts that we put into what goes into our body. Yes. When you're talking of healthy eating, of late, if you go to the shops and you're looking for organic farming food, they are pricier, but there are ways that you can go about this. Let's look for those food that are in season. Let's look for the processed one. Let's use those less, because so many things go into those to actually preserve them longer, and not everything in that processed food is good for us on a long-term use. So you see where I'm coming from. Let's be let's think about what goes into our body. It's really important. Let's think about it. It's really important. Yes, and this is what she said. She said every pound you spend on nourishing our bodies is actually an investment that pays us back in an amazing way. Honestly, when I read this, I was like, okay, I need to share this. So every pound that you spend on getting what the body needs is an investment for a lifetime. On that note, I would say remember, you and your community are responsible for your well-being. So make a positive influence or an impact wherever you are. Thank you. Remember to share, subscribe, and comment. Like as well. Don't forget the notification button. Till I come your way again, this is me, Janet, on behalf of the group. Oh, before I go, there are changes happening in the background. You will soon be notified. so much changes. They are exciting ones. So, till then, I say keep healthy. Bye bye.